Hi, everyone, and welcome. My name is Sam. I'm a community health nurse here at Rush, and today I'm going to be doing a quick presentation about immunizations or vaccines for older adults. I'm going to try and keep it under 10 minutes today, too. So, with respiratory virus season here, with flu and COVID and RSV, now is really the perfect time to talk about how vaccines can keep us healthy and safe. Before we get started, just a quick medical disclaimer. The content presented here is for informational and educational purposes. It's not intended for medical advice. It does not take the place of medical advice or treatment from a provider. So be sure to consult or ask your own provider or qualified healthcare professional for specific health concerns and questions. Okay, so let's get started. What do vaccines do? So let's talk really quickly about what vaccines actually do for us. They do help prevent you from getting sick in the first place. They teach your immune system what to look out for, kind of like showing it a wanted poster. So your body knows how to fight off a certain virus or bacteria if you're exposed later. That means you might not get sick at all, or if you do, you're less likely to get really sick or end up in the hospital. Getting vaccinated just doesn't protect you, it protects others around you as well. Some people can't get certain vaccines, like newborns or those with weak immune systems or those who may be pregnant. So when you get vaccinated, you help create a protective circle around them. That's what's called community protection or herd immunity. So vaccines are one of the simplest and strongest ways to take care of your own health and protect the people around you. So what vaccines are recommended for me? First, we'll talk about influenza or the flu vaccine. Everyone who is 6 months old and older is eligible for a flu vaccine every season. If you're 6 months old to 64 years old, you get a regular standard flu vaccine every season. For those who are 65 years old and older, there are flu vaccines designed specifically for older adults. The CDC recommends that people who are 65 years old and older receive a higher dose flu vaccine, or what's called an adjuvanted flu vaccine, one basically with an additional ingredient called an adjuvant, which helps create a stronger immune response in your body. These vaccines are potentially more effective than the regular standard flu vaccine that everyone else would get, but be sure to talk with your healthcare provider or your pharmacist about which vaccine is right for you. Generally, older adults shouldn't get vaccinated too early in the year, like July or August, because protection may decrease over time. So right now is the best time to get vaccinated. Typically, we say between September and October. Next, we will talk about COVID. Everyone who is 6 months old and older with either health conditions or who are at risk for serious complications, be sure to talk with your provider. For those who are 65 years old and older, you are eligible for a COVID vaccine right now. There is no preference, by the way, between the different COVID brands like Moderna or Pfizer. It's just recommended that you get one. So if you've stuck with one the whole time, you continue to stick with it, that's perfectly fine. Or if you want to mix and match, that's fine too. And to talk about the RSV virus, or respiratory syncytial virus, that's what that stands for. For this vaccine, if you're 50 years old to 74 years old, the RSV vaccine falls under what's called a risk-based recommendation. So if you have medical problems or conditions or have a weakened immune system, you would be eligible for an RSV vaccine, but of course should talk to your provider about that. If you are 75 years old and older, everyone in that age group is eligible for an RSV vaccine. I did want to make a small note that the RSV vaccine is not currently an annual vaccine, meaning you don't need a new dose every season like you would with COVID or flu. So if you have already received an RSV vaccine, then you are good to go and you don't need another dose at this time. For the pneumonia vaccine, or it's called the pneumococcal pneumonia vaccine, if you are 19 to 49 years old, again, those with certain medical conditions and other risk factors like chronic diseases, diabetes, anything else that might affect your immune system, be sure to talk with your provider. If you are 50 years old and older, everyone in this age group can receive a pneumonia vaccine. You don't have to have any other medical conditions or problems. And by the way, there are a few different types of pneumonia vaccines available, so it's best to talk with your provider or pharmacist about which one is right for you. Moving to the Tdap vaccine, standing for tetanus, diphtheria, and pertussis. And pertussis is also known as whooping cough. Pertussis can make older adults very ill, very, very sick, and they can also spread it to small babies and young children. So this is a very important one as well. If you are 19 years old and older, you should receive a Tdap vaccine like as a booster every 10 years. For those who are 65 years old and older, CDC recommends that you should receive the Boostrix Tdap vaccine, which is recommended for this age group, typically every 10 years as well. So be sure to talk with your healthcare provider or pharmacist about that. I'm sure most of you, if not all of you, have heard of shingles caused by the varicella zoster virus. So vaccine directions. If you are 19 years old to 49 years old, can receive it if you have certain medical conditions or weakened immune system. So talk to your provider if it's the right time for you. If you are 50 years old and older, you can get it's called a series, which is 2 doses. The 2 doses are given usually 2 to 6 months apart. And by the way, there's no maximum age for getting the shingles vaccine, meaning you can never be too old to receive the vaccine. And one series, which is the 2 doses, is only needed once in your life. So it's not an annual vaccine that you get every fall. So you get that series, those 2 doses, and then you're done. You don't have to worry about it anymore after that. Okay, so let's talk about side effects. I will say, keep in mind, everybody is different. So some people may experience certain side effects after receiving a vaccine, and some people might not. But keep in mind, most common side effects are a sign that your body is building immunity or building protection against a disease or virus or illness. So it's doing exactly what it's supposed to do. And the common side effects that we experience will go away, will resolve on their own, and go away in a few days. So just keep that in mind as we move forward. So we can talk about this chart really quick. These are some side effects in the orange, and then in the blue column is what would we typically recommend that you do about them. So a sore arm, which can happen, I know especially when you get the COVID and flu vaccine, it goes right into your muscle and your deltoid muscle in your arm. It can cause some soreness. Totally normal. It's best to just move your arm and use your arm normally. We also recommend applying like an ice pack to it if that feels nice and comfortable to you. Another common side effect is feeling really tired or being fatigued. I would recommend resting when needed. So make sure you're taking the time to rest after a vaccine. Another common one is headache. I know that's a side effect that I experience too. Fever and chills can also happen. They tend to be a little bit less common, but make sure, again, to take it easy. You can take a pain reliever, whatever pain medication that you normally take. Anything over the counter is fine too, like Motrin or Tylenol or anything like that. If your fever is 102 or higher, I would call your provider for advice and figure out what to do if there's anything that needs to be done. Muscle aches and soreness is another big common one. I know I feel this one as well. And you can take pain relievers if needed, if you need to. If you don't need to, then don't. You can also use a heat pack or an ice pack if that feels comfortable. Now, if you experience trouble breathing, that is not a common side effect. That is very abnormal, so we want to make sure we call 911 for help right away. And just a reminder, again, these common side effects will go away on their own in a few days. And like I said, I recommend a lot of rest, drinking water, taking it easy after you receive a vaccine. So what else can I do to keep myself safe during this respiratory viral illness season? So vaccines are a powerful way to prevent illness, but they're just one part of the picture. There are also some simple everyday habits that we can all do to help stay healthy and help protect those people around us as well. Things like washing your hands regularly, covering your coughs and your sneezes, and keeping your distance from people who are sick. All of those things can go a long way in reducing the spread of germs. If you're not feeling well, staying at home when possible helps keep others safe, especially older adults and people with weaker immune systems. Cleaning and disinfecting frequently touched surfaces like doorknobs and countertops, improving the air quality in your home, like wearing a mask in a crowded area. High risk settings can also add another layer of protection, especially during cold and flu season or when viruses are spreading. These steps may seem small, but together they really do make a big difference, especially when paired with vaccines. So you can get vaccinated at many different locations around your community, including your provider's office, pharmacies like CVS or Walgreens, community health clinics or public health departments, hospitals, local chains or grocery stores like Jewel-Osco, or community health fairs and other types of events. So it's important to find a location that's convenient for you and to keep up with the recommended vaccines to stay protected. So don't hesitate to ask your healthcare provider where you can get the vaccines that you need. As we wrap up today, I just want to leave you with a few key takeaways. Vaccines are one of the most powerful tools we have to protect ourselves and those we care about, and that protection becomes even more important the older we get. Staying up to date on vaccines, practicing everyday prevention, and talking openly with your healthcare provider are all simple but meaningful steps you can take to stay healthy and independent. So remember, it's never too late to protect yourself. And if you ever have questions, don't hesitate to ask. Staying informed is a part of staying well. Thank you everyone for watching. This is the end of my presentation. I thought I'd end with a nice picture of me and my grandmother here. Remember everything we talked about today. Be sure to spread and share this information with others. And ask your healthcare provider any questions you have about vaccines or what's right for you. Otherwise, I hope everyone stays happy and healthy and safe. Thank you so much.